to the platform Swiss Liver Patients Association, Swiss HEPA. Today with the interview by Professor Darius Moradpour, head physician of the Department of Gastroenterology and Hepatology at the University Hospital Lausanne, on the topic of Hepatitis E. Welcome, Professor Moradpour.
Good morning, Mrs. Popzin. Thank you for your kind invitation.
My first question, what is Hepatitis E?
Hepatitis E is an inflammatory condition of the liver that is caused by the Hepatitis E virus.
What is the average incubation period?
The average time between the moment of infection and the appearance of clinical symptoms, if they do appear, is anywhere between 2 weeks and 8 weeks.
How can you get infected?
Hepatitis E virus is an enterally transmitted virus. That is, it infects us through the digestive tract. And there are two fundamentally different scenarios in hepatitis E. There is one type of hepatitis E that is caused by genotypes, viral genotypes 1 and 2, which presents a human infection exclusively that is transmitted commonly through contaminated drinking water, that is through the fecal-oral route. And this occurs in regions of the world that have limited resources in terms of sanitary and alimentary hygiene. Then there is a second type of hepatitis E that is zoonotic transmission of hepatitis E. That is infection that can occur in certain animals and in humans. And this is typical for viral genotypes 3 and 4 that can infect a variety of animal species, especially domestic pork, but also some wild animals. And this transmission occurs primarily through the consumption of undercooked meat, that is especially undercooked pork meat.
What are the symptoms?
The symptoms, especially for genotype 3, that is common in our country and in Europe, are often very mild. As a matter of fact, we believe that most infections by this virus occur asymptomatically, that is without any symptoms. However, symptoms can appear and they can sometimes be severe. These symptoms can be rather non-specific, fatigue, abdominal pain, maybe some nausea or vomiting, or they can be more specific with the appearance of jaundice. In hepatitis E, it's important to note that symptoms can also occur outside of the liver. For instance, patients can develop neurological complications.
How is hepatitis E diagnosed?
Hepatitis E can be diagnosed by the elevated liver function tests, elevated transaminases and elevated ALT, and then by serological and molecular techniques. There are serological assays that detect antibodies against the hepatitis E virus that, however, have variable sensitivity and specificity. So if possible, therefore, we like to confirm an acute or a chronic hepatitis E virus infection by a molecular test that is a PCR that allows to directly detect the viral genome.
How is hepatitis E treated?
Acute hepatitis E does not usually require specific treatment. It's a self-limiting disease that maybe requires some symptomatic treatment, such as hydration, anti-emetic treatment, or others, but usually not a specific antiviral treatment. However, we have to know that in hepatitis E, it is possible that chronic hepatitis develops in immunosuppressed patients. Patients, for example, after an organ transplant that have to take anti-rejection medication can develop chronic infection with this virus. And in that case, we need treatment. First, what is done usually is, if it is possible, to try to reduce a little bit the immunosuppressive treatment, but that often does not suffice. And then an antiviral treatment is used that is based on ribavirin.
How widespread is hepatitis E?
Hepatitis E virus infection is actually the most common cause of acute viral hepatitis. It is very widespread, both in resource-limited settings with genotypes 1 and 2, as well as in resource-rich settings with genotypes 3 and 4. In Switzerland, the seroprevalence rate in the population is around 20%. That is, 1 person in 5 has had contact with this virus in Switzerland, which is a lot, and which also indicates to us that most infections occur without symptoms or with very mild symptoms.
Who is at risk?
Persons at risk for the viruses that circulate in resource-limited settings, that is genotype 1 and 2 viruses, are pregnant women. For reasons that we do not understand very well, there is a high risk of developing fulminant hepatitis in pregnancy when such an infection occurs. However, with the viruses that circulate in Switzerland or in Europe, genotype 3 and 4 viruses, this does not seem to be the case. Persons who are at risk in that situation are patients with pre-existing chronic liver disease. If one has a pre-existing liver cirrhosis, this person is at risk of developing severe hepatitis E, or persons that are immunosuppressed, because their evolution into chronicity can occur.
How can you protect yourself?
For the virus that is endemic, again in resource-limited settings, it is essentially sanitary and alimentary hygienic measures. To protect ourselves from the virus that is present in Switzerland and in Europe, the zoonotic virus, it is important to heat correctly, cook well meat, pork meat and game meat. That is the most important measure.
Is there any information material on hepatitis E?
Yes, there is information material on hepatitis E. I mentioned some, including a review article that we prepared in my presentation. The website of Swiss Hepatitis also provides valuable resources, and so do the websites of the Swiss Federal Office of Public Health and the WHO.
My final question, as a specialist, is there any recommendation or advice you can give to patients with hepatitis E?
Well, if you have hepatitis E, you cannot do much. I mean, in that situation, it's important that you're being followed by your physician. The thing is, maybe try to avoid undercooked meat also after having had a hepatitis E, because we know that this is an infection that can recur. You can be infected again. It's not the same infection that recurs, but you can get infected again a few years later. So avoid risky food consumption that is, again, undercooked or raw pork or game meat.
Thank you very much, Professor Moradpour, for your understandable and helpful interview, which can be an additional important source of information for patients. Thank you very much.
Thank you very much, Mrs. Bozzi.